Well, the committee wants to recognize the needs for sufficient comprehensive services for youth who run away from home and become homeless. We as a city need not to only work together to prevent these youth from becoming runaways and homeless, but we also must work adequately to find care for special population if they become involved in the juvenile justice system. It is also important that we ensure that our youth leaving the juvenile justice system will not be forced to return to life on the streets, but instead be able to be provided proper discharge services that will reunite them with their families and their communities. The community looks to learn how the Division of Youth and Family Justice has made efforts in innovative initiatives and partnerships with many of our community-based organizations to address various issues facing New York City runaway and homeless youth. Our jobs is to save lives, regardless of our young people are 13, 14, 15, black, white, whatever color we want to claim ourselves, whatever our sexual orientation is. At the end of the day, we and adults in this room vow to responsibility to help young people who are in crisis. I'd like to introduce you all to hip-hop artist Casanova, who is joining us to tell his story to help our young people and the city of New York understand what we can do to improve conditions that he had to experience.
Hello, how everybody doing? My name is Caswell Sr. I've been locked up in and out of jail since 13. Running away, that's regular, you know what I'm saying? I've been in solitary confinement 24 months straight. I thought of suicide. I thought of all the things you could imagine. Criminal justice system, I just think it's harsh. And it's worse as a kid than an adult because I think when I went to jail as an adult, it was just more calm. Like as a kid, it's just reckless. You don't really got nothing to live for. And the COs is worse than the inmates because, you know, they let you get beat up, they let you get jumped. It was traumatizing. I saw certain friends. I think that all of us need to help people leaving jail. Because when you, like me, I did 7.5 years straight as an adult. And coming home, I had nothing. You know, I was blessed to be in the studio and become a rapper, signed to Jay-Z's label, Rock Nation. But all of my friends wasn't that lucky. Some of them are back in jail, 25 to life, 50 years, 10 years. But it all started with us being juveniles. Like, it was like a repeated situation. We'll go to jail, come out, go to jail, come out, go to jail, come out. But I think that's because we wasn't getting help in jail. They don't give you a out when you in there. It's like, you're gonna come back. Don't worry, you're gonna come back. It's not like, let's help you not come back. I think we need programs in jail so you can stay out of jail. You know what I'm saying? They got certain programs in there like ASAT, KSAT, I don't know if y'all understand. It's like drug programs, anger management programs, but it's not really programs to help you cope with being outside. Like, I didn't even know how to go get my ID. Little stuff that you should know as a man, you don't know. I didn't know how to do income taxes. I didn't know anything. So it was like, I was ashamed to even tell a girl, like, I need help going to the DMV. You know what I'm saying? We should have something where they'll get their IDs and stuff like that from in there, their welfare from in there. Like, some people are afraid to go to the welfare office to get their food stamps because they don't want to be joked on. Because your mental is still like a little kid. Like some people be like, yo, how you having so much fun? You 31, you moving like 17. Because I still feel 17. I've been going so much years, I still feel young. And I just think we need to help from the inside for the outside because it's none of that in there. They don't show you how to do that in there. You just working, you just fighting, you just doing the things that criminals do in jail, convicted felons do, you know? But it's nobody in there telling us how to cope with being outside. And mental health issues is crazy, you know what I'm saying? Sometimes I gotta catch myself, like, it's hard coming home and then seeing your daughter that you never saw before and being able to father her and you don't even know how to take care of yourself. Again, I just think we need to build something like with 90 days of somebody coming home, 100 days, a year even. Come in this program, we're gonna show you how to deal with being a civilian, not just being in the streets, but being a civilian. I say civilian because, you know, you could come home and just be who you want to be. I'm talking about coming home, doing the right thing, getting a job, understanding what a pay stub is. My first pay stub, I was like, what the? What? Why are they taking this out of my, like, you know what I'm saying? So just something that teach us what's going on in the streets. Thank you, baby. Thank you. Any questions?
I just want to say thank you for your being humble and being honest. We need to figure out that 6-month plan. What is a 6-month engagement plan? I know we do have plans. What is a plan to teach somebody of civility? I'd like to turn the microphone over to the great Debbie Rose out of Staten Island, chair of the youth committee.
With Raise the Age, we have people who are coming into the system who are young people or juveniles who are children, and there's no mechanism to help them make that transition from being a child to being an adult. Runaway and homeless youth are one of the most vulnerable populations within our great city, and they are the ones who are so often victimized and who deserve our attention. This includes physical, emotional, sexual abuse, as well as neglect. Things that exacerbate and perpetuate this endless cycle that they are in.
Last year, October of 2018, 16-year-olds came into the system as juvenile delinquents, finally after 100 years away from the criminal justice system. This year, October, those 17-year-olds that actually they're still going to the criminal justice system will finally be coming into the fold of the juvenile justice system. In New York City, we make the decision and commitment that our youth were our youth, and all of those young people are actually in the community in close to home, and all of them leave their placement sites with at least 4 months of aftercare, where they're supported and they're actually taken care of and connected to services in preparation to be successful in the community. We work really hard with our partners, actually the NYCC, to make sure that our young people in detention get a summer job, get a bank account. Finally, those 16 and 17-year-olds are gonna come into the juvenile justice system where they belong.
Overall, admissions to juvenile detention and placement, as well as foster care placements, have decreased significantly year to year because of the intensive preventive services that New York City has made available. ACS has intentionally invested in programs and services that are specifically aimed at working with youth, but that also engage the whole family unit to improve family functioning rather than merely looking at the youth's behavior. The Family Assessment Program. DYFJ's Family Assessment Program, or FAP, is available to families with youth up to age 18 to help avoid involvement in the foster care and juvenile justice systems. FAP prioritizes therapeutic preventive services that help families address difficult teenage behaviors like truancy, using drugs, running away from home, and/or struggles with mental illness as the best way to improve family dynamics and outcomes for youth and prevent running away and homelessness. To obtain assistance with a challenging adolescent, parents often go to the family court to file a PINS petition. Parents and guardians are looking desperately for support through court supervision, placement of their child in foster care, respite, or quick access to services. Parents who seek a PINS petition in family court are required by statute to participate in diversion services before a PINS petition can be filed. Prior to a PINS petition being filed, social workers meet with families and conduct an assessment of the caregivers and youth and determine which level of services in our continuum meets their needs. All of these services are at risk in the state's proposed 2019-20 budget. ACS respectfully asks the City Council to join us in our effort to prevent these budget actions from proceeding, both so that the foster care system can still serve youth who are a danger to themselves or others, and so that the state maintains its $3 million of support for PINS diversion services. JJI serves youth who have been adjudicated in family court and provides intensive home-based interventions to keep young people who do not need to be confined safely in the community with necessary services and supports. The vast majority of young people in the juvenile justice system, as high as 90% regardless of gender, have experienced some sort of trauma. We know that there is a close correlation between child maltreatment and future delinquency. The term crossover youth describes a young person who enters the justice system while involved in the child welfare system. Many of these youth are at serious risk of homelessness. They tend to be adolescents who have either a long history of child neglect and/or PINS-type behavior. If a family court judge finds that a young person has committed an offense and at disposition finds that the youth needs rehabilitative services, the judge may order the youth to be placed in a residential placement program for a period of time, generally 12 or 18 months. Before close to home, these youth were placed in large institutions 2 or more hours away from their families, leading to family disengagement. Now with close to home, youth are placed in small group home-style residence throughout the city, where they receive intensive and therapeutic residential programming, followed by aftercare support for the remainder of their placement period. Close-to-home providers encourage family visits and, if needed, transport families to the residences for visitation, meetings, and other activities. The ACS Permanency and Placement Specialist, or PPS, assigned to each youth, the goal of close-to-home aftercare is to build on the skills of youth and the family and to develop a network of support that will allow them to succeed in the community. And DYFJ is committed to supporting youth, families, and communities to achieve that goal. When we talk about runaway and homeless youth and the connection to the justice system, we must acknowledge that some youth are without family support because they are not accepted for who they are and are either put out of their homes or cannot tolerate living with emotionally or physically abusive parents. Some of these youth also identify as LGBTQ. ACS has long made affirming and supporting our youth a priority. The evidence-based services available throughout DYFJ's continuum can often be a catalyst for family acceptance and reunification for LGBTQ youth, and we have served many of these families through FAP and JJI. We also commend our sister agency, NYCC, for dedicating significant resources and programming to meet the unique needs of these youth. Commercial sexual exploitation of children, or CSEC, is a form of child abuse experienced by many justice-involved youth. ACS has made supporting this population a priority, and at DYFJ we have partnered with the Girls Education Mentoring Services, or GEMS, a nationally recognized organization that works with sexually exploited young women and girls. GEMS uses survivor leadership and transformational relationships to work with young women in our secure detention and close-to-home facilities to educate young people about CSEC and encourage survivors to seek help. Traffic and gang-involved youth are often branded with exploiter or gang symbols. ACS has partnered with medical providers who offer pro bono tattoo removal services to youth affiliated with ACS, whose brandings have hindered their ability to positively move on with their lives. In June of 2017, ACS opened a family support center in the South Bronx, which provides a multi-service, one-stop space for youth and their families. The Bronx Family Support Center houses FAP, JJI, and close-to-home staff, and enables families with justice system involvement to have many of their service needs met in one centralized location. However, services offered at the Bronx Family Support Center are not limited to families with justice system involvement and are open to anyone in the community. DYFJ partners with Community Connections for Youth to provide workforce development, parenting groups, housing assistance, and education workshops. The space is designed to be shared with the whole community, welcoming everyone, including those whose children are not at risk or court involved. The Bronx location is presently the only family support center in the city, and we are planning to open a Queens Center in 2020.
Speaker Johnson testified yesterday up in Albany about proposed cuts to ACS and reimbursement. I think it's appalling that in the day and era that we always say the two things that should be off limit when it comes to the budget is our children and our seniors, and that we think that it's okay in the financial world that it's okay to cut the souls of young people trying to figure it out. Again, if we're truly saying that they are our future, then why are we trying to misstep and take away all the resources of the individuals who are trying to help our future? Don't let anybody from the state or the federal government cut the budgets that you need to make sure that our children have the access to financial opportunities to make themselves better.
Two things. No one is discharged ever from detention without actually having a family to go to. I mean, family court judges, by practice, ensure that everyone has a place to go to before they get discharged from detention. And in the placement system, again, New York City, we close to home, we actually think exit at entry. Every young person, as you know, Associate Commissioner can expand, gets assigned what we call a permanency planning specialist that is working to ensure that they don't just learn new skills and reduce the risk of reoffending, but also make sure there's actually a permanency resource when the person goes home. No one goes home from close to home without actually having at least 4 months of aftercare.
what does that number look like of how many runaway youth we've helped and they've returned home or to a stable environment that they're moving forward, and how many couldn't figure it out who had to return back for additional services in our system, whether it's in the juvenile justice system or whether that's close to home or...
Right. So the family assessment program, which I think is what you're referring to, the 5,000 families that we serve, all come in with their parent to seek services through the family assessment program. So they are all connected to their families, although they may have issues with whatever's happening in their homes. And what we try to do at the family assessment program is strengthen those families so that those young people do not become homeless. The ones that are coming to us through the family assessment program all come with a parent. That's how they reach us, is the parent finds out about our services and we offer them those services to keep them together and reduce the kids from being homeless. Our staff, our case management staff and our placement and permanency specialists are outreaching to those families in order to re-engage them in the services that we offer so that the young person has a place to be discharged to when they end their placement with us. If it happens that the parent remains disconnected, then that's when we are engaging our child welfare and potentially placing them in foster care.
If a young person gets brought in by the police, for example, to our detention sites, we immediately do triage, a certain amount of intakes within an hour. But one of the things we do in our juvenile justice system, doesn't happen in the criminal justice system, is that every young person gets assigned a case manager. And that case manager actually works with the family, identifying the family resources, with the court, with the attorneys, to make sure that actually everyone is involved in the care of that kid. Most young people actually may be released on their own to probation, again, only if they have a permanency resource or family to go to, or they could be released back into close to home if they're adjudicated. It's the practice of the family court and the juvenile justice system that families are an essential voice in the court, so they're always engaged. If they don't have a family, being part of the child welfare system provides a unique opportunity to then find permanency resources of a different sort. But no one ever is released in New York City without having someone to go to.
There has to be some type of mechanism to track children who are homeless in the system, how they've engaged in the juvenile justice system. There has to be something.
Yeah.
And I don't know if it's the microphones, but I'm not hearing what that looks like or what it is, so we're able to have a number. And if it's not existing, maybe we might want to consider something different.
There were 220 unsheltered youth, and that number is derived from both the Hope Count and the Youth Count.
Okay.
The Hope Count is done by DSS, DHS, and the Youth Count is done by DYCD. These numbers come from intake when the case management staff at the provider level has a session with a youth and they divulge this information to them. From the first year that we've done this, we only had 7 sites that we processed the youth count. From this youth count that we did this year, we are close to 70 sites. And we've included, and during the first count, we only did it at our drop-in centers, one cornerstone. To date, we do it at our drop-in centers, at our crisis services programs, in public schools. We do it at libraries. We do it street outreach-wise. So we've grown the program to get to as many youth as we possibly can at many different locations that have been identified. What we've also done is we've created a work group, Youth Count work group, that has both government agencies on it, it has advocates, it has youth, as well as others who are interested in youth services. We've also brought on Youth Count coordinators who control focus groups, which we have done with the Coalition for Homeless Youth. And from those systems, we've been able to create a methodology on how we're going to do this. We've identified places where we will make sure that, the volunteers or the staff that go out to do the surveys know where to go in order to conduct the survey. And we've also used this time to create and work with CIDI in order to get the data to present and attach to the Hope Count in the addendum to make sure that folks are aware of the numbers that are out there.
But there's still a lot of youth that we've heard that don't know that these programs are available. How do we make sure that the kids who need the services get access to it?
We are in the process of onboarding more beds, especially for under 21 by the end of this fiscal year. That allows for a total of 813 beds for runaway and homeless youth between the ages of 753 for 16 to 20, and 60 beds for 21 to 24.
Before a PINS filing can be accepted, families have to go through the diversion program. Okay, and I saw that there were 3 levels of diversion programs. What are we doing so that beyond the 4 months or the 5 months that they're interacting with these diversion programs to sustain what it is that's needed?
So the programs listed there are the evidence-based programs that ACS contracts with. And so those programs were developed and researched specifically for at-risk youth and youth who are involved in the juvenile justice system. They are extremely intensive programs. In fact, MST, the first week you're connected with MST, a therapist is out in that home at least 3 times a week. They're on call 24/7 for the parent if there are any crises that occur. So they're very intensive programs where they're working very holistically with the youth and the family. Part of those programs are to connect the families to other services if they need them. So the contract provider will work with that family. It's actually 3 to 5 months is the average length of stay for those programs. Once that ends, they are no longer involved, but they can always come back to the family assessment program if they need additional services or some other assistance with anything else.
When the roots of the problem are poverty,
Yes.
and deep-seated family conflict and lack of employment, until those issues are addressed, I think we're going to be just addressing the symptoms without getting to the roots.
We need to take a 2-generation approach to solving these issues. I mean, we have to take a 2-generation approach to many of these issues. So what we're doing in the Family Support Center, which we testified about, is finally not just focusing on really good evidence-based programs that help the family reunify and connect better, but also support to the parents.
And help children to feel good about themselves, which means understanding their cultural backgrounds and respecting that and elevating that. And there's a lot that we have to do beyond just addressing the symptoms that are manifested.
So on aftercare, or the for juvenile delinquents, so if the family court places the young person in close to home, then the young person does get a period of aftercare where they are in the community. We are trying to, those kids are generally with their parents and not in DYCD's system. Again, if their parents are disengaged, generally they're going to our foster care system and not DYCD's runaway and homeless youth system. I can speak for what my staff does in terms, if they are seeking information from another agency, then consents are required in those situations. So if that were to happen, consents should be signed. But again, our kids are not going to the DYCD system.
Well, for DYCD, we have a major social media campaign where we have an e-blast that goes out from our Youth Connect department to about 25,000 people. We also have our websites with Instagram and Facebook, and we put it up on our website, all of this information, that they can go to any of our drop-in services to receive additional information, or they can call our Youth Connect hotline and to receive other information. And as you know, there's the new local law that allows for additional information. So we're putting out palm cards, we're putting out flyers, we're putting things up at different locations in order for people to be aware of the services that DYCD offers. And when we do presentations, we provide those in attendance with information on DYCD. We have a blue book that describes all of the services, because DYCD is not only RHY. We have our summer youth enrollment programs, we have a workforce, we have a community development side. So we make sure that folks are very aware of what's happening within the agency so that they can access the services. Well, for DYCD, we have our monthly provider meetings. So at those monthly provider meetings is where we share updated information and make sure that they're aware of what's happening. We like I said, we try to get the message out there as much as we possibly can so that everyone is aware of the services that are available to them. The fact that we have 24-hour drop-in centers now allows for youth not to have to go to places that they may have gone before. Now they can go to a place where they can get case management. And that goes back to the local law that I was talking about in terms of how now we're promoting our services more through the creation of posters, through the creation of flyers, also through the creation of palm cards, which can be easily put into your pocket so that you can carry it around with you at all times. That gives you the access numbers and the locations to make sure that you know where to go at any time to receive services on any service that DYCD offers. As well as we have a great relationship with 311, so that if any youth should call that number, they can then provide them with information as well. So we're looking at the many different streams that we can access in order to get the information out, and through some of the work that's being done internally, we should have that out very soon, and making sure that our providers are knowledgeable in terms of doing outreach in their communities, so that they are aware of the services that are provided, especially in our drop-in centers.
We can't sit up here and say, well, I posted it here, and then expect a 14-year-old who's lost, who's running from a traumatic situation, to know our system. How are we better in having that communication? How are we reaching young people who are out there? Because as I looked at the numbers here, which y'all did not, and I'm not mean to put you on blast, but in 2008, there was over 3,600 runaway youth. According to the report here, we also know that 90% of the brothers that are in there, 90% of your runaways are people of color. So how does that have an impact in your communication and your outreach? And where do we go with those numbers now that we know that those are numbers? And is this a real number? And if it is, we got a bigger problem. Again, I'm sorry, I want to apologize. Earlier I said that the system is flawed. No, the system isn't flawed. The system is doing exactly what the system was designed to do. We just got to help the young people understand that they're living in a flawed society, that they're not getting it right. So what do we do in that system to understand, to change, to have a paradigm shift to save these souls? How is the system doing a better case of outreach to knowing the numbers? So we know who we serving, how do we serve, and what is our messaging to say this works and it doesn't work? Because of how are you working with the adults since that everyone has the same information, whether you're 14 or 28?
We also have a street outreach team, and our street outreach team canvassed the New York City area, engaging youth at many different locations in order to make sure that they have the necessary resources and information. Currently, the hours for street outreach are 7 p.m. to 2 a.m. Have worked with our sister agency, DHS, on many issues in terms of making sure that they have knowledge of our system, even giving them access to our available beds so that they can make the necessary referral to the bed. We provided training to them, meaning their staff at their different intake centers, so that they know how to access our system and communicate with us on a daily basis, and if they should come into contact with youth that may fall within our age criteria.
We are Exalt Youth, and we have been in existence for over 12 years, but we are a spinoff from CASES, one of the oldest alternative to incarceration program. And overall, our model has been able to show that we have been able to work very well with young people who have been impacted by the criminal justice system. So we focus on three particular areas, which is educational progression, ensuring that young people move out of the criminal justice system, and employability. You know, the last data in 2017 begins to show that about 7,000 young people have been impacted by homelessness. With our youth, we serve young people ages 15 to 19, and we're growing to essentially serve more young people throughout the 5 boroughs. Exalt has been in existence, and we have tested a model that literally begins to show that 2 years out of graduation, 8% of our young people are not reconvicted of a crime, and that's significant. 95% of our young people are graduating from high school, but we're seeing a growing body of youth who are going off to college. And then our internship model, we have been able to engage youth in some of the best places. We've had many of our youth testify in front of City Council because they intern with Innocence Project, the Children's Defense Fund.
Incarceration is one of the root causes of homelessness and for instability in housing for our youth. And so we are not a housing organization. However, we do find that many of our young people, through the course of their participation with us, lose their housing or encounter unstable housing. And our model has an answer for that, because we're providing young people with skills, we're providing them with paid internship opportunities, we are helping them to understand how to navigate the nuances and complexities that exist between the incarceration system and the outside world. And we're really preparing them for a life of success, opportunities, and freedom by speaking to them at their level, from a place that they can understand. At Exalt, we utilize critical pedagogy, which is Paulo Freire's methods of engagement, to capture youth where they are so that they can pursue freedom and understand the connections between education and freedom.
In particularly Brooklyn, we have been able to have judges and DA reduce sentencing, from felony charges to a misdemeanor or vacating. This is significant because when we talk about the cycle of poverty, we do know that if a young person is convicted of a crime, and we've heard this so many times, young people are not able to find and gain employment. They're not able to access housing. So we are doing something, very, not necessarily different, but I would say it's the courage, to ensure that we're advocating correctly. We're coming into Manhattan, and we're serving more young people coming in from Staten Island. We have a pretty good, strong model that begins to show that we have, good results.
What is it that you're doing right or that you're doing differently? And can we sort of connect the dots here so that we're able to make a difference in a lot of young people's lives?
So what we have been able to do is really bring language to the challenges that a young person is facing even before we prepare them for the world of work. If you come into our office, which I have invited you, we have no rules. We set a tone. And I think that at the core tenet, what we're saying is that we humanize our youth. Some of the things that we do bring to the table, it is real relationship. When I think about the results that we gain with judges and with the DA, that is beyond trust. We have our mechanisms, we have the way that we, communicate the challenges that a young person has, but essentially, we're highlighting and we follow the stages of change methodology, which is a relapse is not a relapse. It is that something happened. So some of the things that we could provide is, technical, assistance. We do follow I would say, the youth development principle, which we all do, but it is that a loving, caring adult navigates a young person, but that adult needs to understand that a young person is facing a lot of significant challenges. And I do appreciate, what you said, Andy, which is a lot of times, we come up with language. Our kids are saying something else. We're always getting their input. And then also giving an opportunity, to establish stronger relationship across the board.
And that's exactly right. And we're happy to provide technical assistance and training because we oftentimes within institutions are dehumanizing our youth and our young people. That happens in the legal institutions, that happens in the educational institutions in our society. And even for those of us who are well-educated and well-trained, we've received training and education that perpetuates that dehumanization. So I have a master's in education, but the kind of training that we're providing to our staff is wholly different. It's really about unlearning a lot of the things that the system has taught us to do to perpetuate dehumanization for our young people. So it's very unique what we do, and we're happy to work with our partners and collaborate to spread that and show how that works.
Thank you, everyone. We are adjourned.